Welcome to Dermat. My dear friends, today your Dermat is in Himalayas, and those mountains, what you are seeing, they are called as Himalayan mountains. Yes, this is Himachal Pradesh, and today we are going to talk about a very common infection, but very chronic infection in dogs. Very difficult to manage. I know, very stubborn, but my dear friends, there is a cure. There is a technique to treat those very stubborn infections. And I know we are talking about the diagnostic challenges of treating canine atopic dermatitis. My dear friends, canine atopic dermatitis is a common inflammatory skin disease of dogs and cats, affecting about 15% of the dogs population of the world. The pathogenesis of this disease is very multifocal, with both skin barrier dysfunction and immunological dysregulation. Again, I will repeat, skin barrier dysfunction and immunological dysregulation, known to have a very important role in this disease management. These both things may be influenced by either genetic or environmental, or both genetic and environmental factors. And my dear friends, as you know, there is no reliable biomarker that can distinguish between canine atopic dermatitis and other dermatological disorders. It is very essential to take the complete detailed history of the pet. Secondly, ruling out the conditions that mimic canine atopic dermatitis. So, a Canadian veterinary dermatologist in 2010, he formulated one criteria called as Favorot's criteria. What is this Favorot's criteria? That helps us, guides us in managing this disease. He says that the onset of the disease should be 3 years of age of the dog or cat. Again, it is not affecting the ear pinnas, it is only affecting the ears of the dog. Thirdly, the dog's front feet are more affected than the hind legs. Fourth is there is a chronic or recurrent yeast infection. And fifth is it is the dorsal lumbar area of the dog is non-affected. The back of the dog is not affected on a larger side or a higher side. Then there is a chronic or recurrent yeast infection. I already told you. But other than that, there is a corticosteroid pruritus. Corticosteroid uh, uh, pruritus is the itching happens till we give uh, itching stops till we give the corticosteroids, and again it starts after stopping the corticosteroids. And this these dogs or cats are mostly indoor cats or dogs. So my dear friends, this is how we have to manage the canine atopic dermatitis. This is a benchmark how to identify which patient is a canine atopic or any other skin infection patients. Also, there are various tests, intradermal tests, as we all know, and also allergen specific test immunotherapy test, IgE tests. These are the tests which help us, to shortlist these disorders and guide the owners of the pets to help us, because unless and until he helps us, the infection cannot be completely wiped out. So, my dear friends, I will be keeping on talking with you about atopic dermatitis in this beautiful weather, and hope you are liking this series of current atopic dermatitis. And see you soon uh, from Himalayas. Thank you for watching Dermatvet.